Life still feels kind of normal in the Stockholm coffee shop, like it was before COVID-19. You can place your order and then chat with a friend, sitting a table or two away.
So I feel like our customers are actually following the guidelines, so they are keeping the distance and they are very not sitting so close to each other.
Sweden has not done what most Canadian provinces have. There are no states of emergency, and businesses have not been ordered to close to enforce social distancing and halt the spread of the infection. Not only are some restaurants still operating, so are schools and daycares.
I follow what the experts says and the people in charge, they take the decisions, and I feel that those measures are good for us here in Sweden.
That idea of trusting each other and trusting the government is what Swedes believe set them and their COVID-19 strategy apart from others in Europe and the world. Deputy State Epidemiologist Anders Wallenston is one of the policy's architects.
There's culture and tradition, and in Sweden this is the way we usually work, and we continue to work with this during this crisis as well.
Increasingly, though, Swedes are questioning whether something stronger than trust is needed. Professor Cecilia Soderberg-Knockler is an infectious disease specialist, one of 2,000 prominent doctors who've signed a petition urging stronger measures.
I think that all other countries that are closed down are going to be able to manage their healthcare problems better.
The critics note Britain initially tried something similar and then abandoned the strategy when it became evident the healthcare system would be overwhelmed. And in Stockholm, that's what everyone is watching for now.
In Stockholm, it's very hard pressure, so we are still struggling to stay ahead of the COVID pandemic, and so far we have succeeded.
But for how much longer? Sweden has seen a spike in fatalities, now with over 3 times more deaths per capita as Norway next door, which is essentially locked down.
I am worried, yes, because just now we've seen that the virus has spread to a lot of homes for the elderly, and that's not a good situation. So yes, I am worried.
It's going to take too long time, and the problem is that this virus is spreading so fast, which means that there are too many people that get sick at the same time, and then you collapse the hospital, so it just doesn't go together. I usually say that this virus is more a dangerous virus for the society than it is for the individual.
This weekend, there were signs the Swedish government's commitment to its outlier plan may be wavering. The cabinet has asked Parliament for sweeping authority to impose strict lockdown-type measures, if it comes to that, to force Swedes to keep their distance. Chris Brown, CBC News, Vancouver.